So, good morning, everybody. Please take your seats. So, first, before I open up here some practical information, there will be a translation here, English channel 2, and 4 will be Italian language. And the session here will be web streamed, so you can find it on a YouTube channel after the meeting. Okay? So, good morning, everybody, and especially good morning, MEP Dr. Tamburrano. Welcome to today's important event here at the European Parliament on the topic of sugar and pathways for improving oral health and general well-being. First of all, I wish to warmly thank you as a member of the European Parliament, Dr. Dario Tamburrano, and your team for kindly hosting this event today. We are honored to have the opportunity to hold this discussion with you today as a former dentist and current representative of the European Parliament. And I, of course, also wish to thank the Left Party in the European Parliament for approving and collaborating on this event. Please, Dr. Tamburrano, address a few words.
Grazie, per me è un piacere accogliere i colleghi perché in realtà non sono un ex dentista, ovvero dentista e medico si è tutta la vita, e anche l'azione politica si ispira ai principi della prevenzione piuttosto che quello della cura. Manca in questo momento una visione di lungo periodo dell'azione politica e che quindi metta al primo posto la prevenzione delle criticità, che siano guerre o cambiamento climatico o problemi di tipo economico-industriale. In questo l'Europa è molto in ritardo nell'avere un approccio di lungo termine e una programmazione, e quello che io volevo raccontarvi brevemente è che lo stare in politica con l'idea della prevenzione e della visione sistemica, dove ogni parte è collegata al tutto, dà sicuramente un modo di vedere e di agire diversa rispetto ad altre professioni, dove questo approccio sistemico olistico comunque non è alla base della formazione. E questo vale anche nella gestione dello stress, che noi dentisti conosciamo bene, e nel dare priorità alle cose e nel riuscire a informare i cittadini con un approccio più partecipativo basato sul consenso. Per esempio, vi sono alcune norme che portano degli obblighi. Io credo che quello non sia l'approccio sempre corretto, perché noi siamo abituati prima di tutto, quando è possibile, avere comunque il consenso del paziente. E quindi questa è una parte che io sto portando nella professione, come per esempio anche la gestione dello staff odontoiatrico che io ho condotto in passato, mi ha aiutato molto nella gestione dello staff e nel rapporto con i colleghi parlamentari e i colleghi di partito. Chiudo raccontando una cosa che noi italiani conosciamo. Vi fu un tentativo di ridurre l'impatto dei danni dello zucchero non solo a livello delle patologie orali, ma a livello delle patologie a livello sistemico, da parte dell'ex ministro della ricerca e dell'istruzione Fioramonti. Vi posso raccontare che vi fu una grandissima sollevazione delle lobby dello zucchero, a partire comunque dall'alimentare in poi, e quindi questo tentativo non è andato comunque a buon fine, perché l'idea era quella di mettere una extra tassazione, sebbene anche molto limitata, sullo zucchero contenuto negli alimenti, cosa che avrebbe portato poi comunque col tempo, appunto visione di lungo periodo, a una riduzione delle patologie sia del caporale che di altre patologie, e quindi a un minore impatto su quella che è la finanza pubblica e il sistema sanitario nazionale. Noi siamo a disposizione per qualsiasi tipo di intervento legislativo che dovesse comunque presentarsi in Commissione Salute, Commissione Sante si chiama, e possiamo dare l'avvio comunque alle relazioni. Grazie molto.
Thank you, Dr. Tamburrano. I will just now briefly introduce myself. Freddy Slot-Gilsberg is my name, a dentist, and as you said, this is a profession for life. There's nothing formal about that. I fully understand. I'm the president of the CED, and our associations represent 350,000 dentists across the European countries. And today's meeting is important, especially in light of the ongoing discussions under the EU Cardiovascular Health Plan on considered measures to tackle risk factors such as unhealthy eating and sugar consumption. Ensuring a healthy oral cavity by limiting the harmful and unequal exposure to sugar will support measures across all three pillars of the plan. Sugar is the #1 risk factor for dental caries, no doubt about it. It also seriously affects other oral diseases and other associated diseases non-communicable. There is indeed no health without oral health in Europe. Today, we will welcome intervention from 5 experts and representatives from national dental associations across Europe. We also had the great pleasure to welcome a representative from the NGO Safe Food Advocacy Europe, and Ogilvio, to provide an insight into sugar from the perspective of consumer protection. So before I open the discussion on today's topics, please understand 5 speakers. I know at least some of you. Time is very precious. You have the time we have offered you. If you use more time, you take away time from the people following you. That's not pleasant. You understand, we are here to support each other also with the time. So, Dr. Mick Armstrong from the British Dental Association, please take the floor.
Thank you. We sit outside Europe. It's nice to be invited as a guest, and we hope we'll be back soon. But I will say that it's always a pleasure to work with colleagues. We remain members of CED, and we hope we contribute to that because we all face the same challenges. I do have a few slides. We have considerable experience in the UK on sugar and the implementation of a sugar tax. I don't know if I can get slides on.
One second, sorry.
Thank you. So if we look at the first slide, if we look at the diseases that excess sugar consumption causes on the graphic on the right, there's a lot of talk about obesity and how sugar affects that. But there are over 100 factors involved in obesity, and sugar is but one. We obviously focus more on decay, and that is an excellent place to focus on because the correlation between excess sugar and decay is almost 100%. And it's there, it's demonstrable, and I think if we focus our efforts on that, notwithstanding there are other benefits of sugar reduction, then that has quite a lot of impact because we are the experts on the oral cavity. So we can improve, by reducing sugar, we can improve general health, but certainly oral health. Nearly all oral diseases, especially caries, are preventable. And if we turn the tap off, that's the sugar tap, we will reduce decay dramatically and all the associated costs. And that involves financial burden of treating that disease, probably £500 billion across the EU. It will also improve workforce and their contribution. It'll improve the educational aspirations of young children, and probably, hopefully not immediately of note, but it improves our fighting efficiency. Many soldiers suffer with tooth decay and are not present on the front line. Hopefully we won't need them, but we never know. And prevention also means a more sustainable environment. If we reduce the burden of disease, we reduce the carbon footprint, and that has a benefit for the environment. So all of that is based on the excessive sugar consumption. If we look at the status of oral health in the UK, it's not a happy picture, and it's getting worse. So the leading cause of admission to hospital for children at the moment is tooth decay. And we carried out 40,000 general anaesthetics on children last year for tooth extraction at a cost of £50 million. Now, that is unacceptable, I think, in a modern society when you've got a preventable disease. And obviously the costs of treating dental disease in the rest of the population are significant, at about £3.5 billion across the population. The prevalence of dental disease, as you can look at from the percentages, is, I think, totally unacceptable in a modern society. And undoubtedly, the overwhelming majority of that disease is due to sugar consumption. So we've had a battle to try and reduce sugar, and we started in 2011 with a soft drinks industry levy, not a tax, because that would affect the end consumer. That is on the manufacturers. They, of course, can pass that on. And notably, Coca-Cola have decided to pass that on. They have not reformulated at all to come back into line with the guidance and the tax levels. We have been opposed by a very powerful industry at every level, every turn, and it's been a long process getting MPs on board. They are very nervous of appearing like a nanny state, but I think this is one area where the nanny state should intervene, and I would hope that Europe sees that as well. So we now have a sugar tax. It only affects soft drinks, although we are trying to extend that to milkshakes, and we're trying to reduce the threshold levels. The threshold level is 5 grams per 100 ml at the moment. We tried to reduce that to 4, and the government said, no, we want 4.5. A microscopic reduction, further reduction, but that has been challenged at every stage, and it will come in 2028. So it's a really long process, but we are getting there. We hope to expand that further onto baby fruit pouches, and even solid sugar, which we propose should be taxed per kilo, again at the manufacturing stage, but we're a long way from that. But at least we've made a start. The big impact, I think, is getting people to hear the discussions we're having. So it's raised awareness quite a lot. We have a lot of public support for what we're doing, so that's the consensual type approach. But that is gathering momentum. We have a few stars leading the campaign, Jamie Oliver, and that undoubtedly helps quite a lot. So the benefits, improved health of the population, and it has worked. There are a couple of papers that show that tooth decay has dropped, admissions to hospital have dropped, not significantly, but again, it's only the first steps. It's economically beneficial. We wanted the money raised from the tax to be spent on dentistry. It wasn't. It was spent on children's sports, but at least it had a viable result for the public to see this is what your taxes are paying for. We would love it to be hypothecated so that any money raised from sugar taxes were spent on oral health, but we can't get there at the moment. As I said, it's raised awareness of the public. It is now debated, and people are more aware. It's absolutely great. The people we see on a regular basis, our patients, know the value of prevention, but we don't see everybody. And in the UK, we only see about 60% of the population at best. 40% therefore need the government to nanny them into a better way of treating their teeth. That's just how prevention relates. but sugar is but one point, and this is what I'd like to leave you with, is that back in 2002 we started on the tobacco industry. And we started by taxing them. We started with a ban on advertising campaigns and sponsorship, and I think that has been remarkably effective. Again, it's taken a long time. But I do believe if we approach sugar like we did tobacco, then I think we will get somewhere. There is no reason why Coca-Cola should be allowed to sponsor the Olympic Games. They pay £9 billion over the last 10 years to sponsor the Olympics. No respectable or first league athlete drinks Coca-Cola. We know that. So why are they allowed to sponsor it? Why are Formula One cars emblazoned with high energy drinks? High energy drinks don't give you any more energy than a glass of water does. Totally unnecessary, and yet their marketing powers are enormous. Their industry muscle is enormous. They've already employed the same lawyers to defend against sugar tax as the tobacco industry did all those years ago. They are prepared for the battle. We should be prepared at the battle, and we should give them a fight, because this is not going to be easy. So that's a bit of a summary of what I would like to see happen with sugar products that has already happened to tobacco. And I think the EU could lead the way, like it did with tobacco, to have some policies on how to deal with sugar and the industry. And I'd like to leave that there. Thank you very much.
Thank you. Oh, sorry. Thank you, Mick, for this excellent presentation. We can then go on with our agenda, and we are good in time. Thank you for that too. I would like now to give the floor to Dr. Fabio Scafidi from the ANDI, the National Association of Italian Dentists, and I think this presentation will be given in Italian. Am I right?
Yes.
So please take the floor.
Can I have the remote control? Thank you. Good morning, buongiorno. Sono onorato di intervenire in questo autorevole contesto e desidero ringraziare l'onorevole Dario Tamburrano, il collega Dario Tamburrano, e il SED per il cortese invito. Porgo il migliore saluto dell'Associazione Nazionale Dentisti Italiani a tutti i presenti. Mi accompagna oggi la dottoressa Alessandra Rossi, membro del SED Oral Health Working Group, a conferma di quanto la collaborazione europea sia essenziale per tradurre le evidenze in politiche efficaci. Un veloce inquadramento del problema zucchero in Italia. Abbiamo già visto dalle parole di chi mi ha preceduto come l'assunzione elevata e frequente di zuccheri liberi sia associata a diversi effetti negativi che qui in parte ho voluto riportare. La produzione e il consumo di zucchero in Italia è ancora abbastanza, direi molto elevata. L'Italia è uno dei paesi con la minore produzione interna, in quanto l'85% del fabbisogno italiano viene coperto mediante importazioni. La nostra produzione locale copre appena il 10-15% del fabbisogno nazionale e produce zucchero a partire dalla barbabietola da zucchero. Il consumo italiano di zucchero vede nelle statistiche grandi variabilità legate ai concetti di disponibilità alimentare e di consumo alimentare reale. Comunque ci inseriamo su un valore di consumo giornaliero a cittadino di circa 83 grammi giornalieri, che è evidentemente un valore molto lontano dai 50 grammi o addirittura 25 grammi ideali che vengono raccomandati dall'Organizzazione Mondiale della Sanità. Un cenno sulla regolamentazione che l'onorevole Dario Tamburrano ha già in parte descritto. Noi nel 2020 in Italia abbiamo istituito la sugar tax, che però ha incontrato diversi ostacoli appunto di natura politica, economica, ideologica, di tipo lobbistico, rinviando di anno in anno la sua applicazione. Il termine adesso è stato spostato al 1 gennaio 2027. Dal punto di vista epidemiologico, in Italia la letteratura documenta un marcato miglioramento negli ultimi 30 anni, per cui registriamo un DMFT medio a 12 anni negli anni 70 di 6,9 e attualmente abbiamo un DMFT pari a 1,09, evidenziando l'impatto di strategie preventive come fluoro, igiene, educazione alimentare e accesso alle visite come strategie evidentemente molto efficaci. Sul versante istituzionale abbiamo un documento del Ministero della Salute che riporta prevalenze di carie pari a 21,6% a 4 anni e a 43,1% all'età di 12 anni, sottolineando evidentemente la necessità di programmi strutturati di prevenzione per ridurre la domanda terapeutica e le disuguaglianze socio-economico e territoriali ancora esistenti. Abbiamo altre fonti dell'Organizzazione Mondiale della Sanità che, per ragioni di tempo e per rispettare il tempo che mi è stato concesso, tralascio, comunque vedete riportate nelle slide. La conclusione qual è? Che questi dati sono sicuramente premianti nel lungo periodo, quando la prevenzione diventa un'infrastruttura culturale e organizzativa. Tuttavia il risultato va letto con realismo. Ho già detto che il problema con le disuguaglianze non è certamente risolto in quanto queste non sono scomparse. L'aspetto chiaro è però che la prevenzione funziona quando è coordinata, corrette abitudini igieniche, uso topico del fluoro, educazione alimentare, accesso alle visite e alle cure precoci. Call to action di Andi. L'Associazione Nazionale Dentisti Italiani, che io qui rappresento, negli anni cosa ha fatto e che cosa continua a fare. Ha sempre contribuito e contribuisce tuttora alla regolamentazione e alle linee guida nazionali sulla salute, ma su questa base si colloca l'iniziativa che soprattutto desidero presentare, il mese della prevenzione dentale, di cui sono coordinatore da diversi anni. È l'iniziativa di prevenzione più longeva in Italia, siamo alla 46esima edizione. È una campagna che annualmente prende l'avvio nel mese di ottobre e che mobilita oltre 10.000 dentisti volontari sul territorio, con l'obiettivo di rafforzare la cultura della prevenzione e di rendere più semplice per i cittadini il compimento del primo passo, una visita di controllo e un confronto informativo con il professionista. Negli anni abbiamo calcolato più di 1 milione di visite e altrettante prestazioni, a seconda dell'edizione, che sono state offerte ai cittadini. Il mese della prevenzione è importante non solo per la continuità, ma anche per le sue capacità di rinnovarsi nel tempo, nel senso che negli ultimi anni ciò si è tradotto in strumenti digitali educativi che facessero acquisire una coscienza da parte del cittadino. Sto parlando del test per adulti, quanti anni ha il tuo sorriso, o i test per i bambini che abbiamo elaborato con i pediatri in modo particolare, i pediatri di libera scelta, che abbiamo chiamato Come cresce il suo sorriso. A questo si affianca poi il manifesto per la salute orale dei bambini con 10 regole chiare su igiene, alimentazione, riduzione degli zuccheri e importanza della prima visita precoce. Accanto a questo abbiamo voluto sensibilizzare profondamente la politica, in quanto questa evoluzione di contenuto che ho appena detto ha avuto anche un'evoluzione istituzionale, nel senso che nel 2024 il mese della prevenzione è stato presentato alla Camera dei Deputati. Un passaggio certamente simbolico ma anche concreto, perché colloca la prevenzione orale all'interno delle politiche pubbliche e all'interno del discorso sull'accesso equo alla salute. In termini di comunicazione istituzionale è un segnale chiaro. La salute orale non è un tema settoriale, è parte di un'agenda di prevenzione, equità e sostenibilità. Abbiamo fatto anche oltre, sempre nello stesso anno, Approfittando della presidenza del G7 dell'Italia, Andi è stata chiamata a partecipare agli eventi paralleli del G7 Salute di Ancona e di Bari, affermando il principio che il diritto alla salute orale passa anche dal dovere personale e collettivo di investire in prevenzione. In quell'occasione abbiamo attivato la clinica odontoiatrica mobile di Fondazione Andi Ente Terzo Settore, dove in 3 giorni di attività e centinaia di visite come modello concreto di prossimità abbiamo prestato la nostra opera e abbiamo diffuso i concetti di prevenzione alla popolazione. Abbiamo ripetuto appunto a Bari, nel villaggio della salute, questa manifestazione. Anche lì eravamo un importante accompagnamento della manifestazione internazionale e la prevenzione odontoiatrica è stata parte di un'azione multidisciplinare rivolta ai cittadini, ribadendo un principio chiarissimo che non esiste salute generale senza salute orale. Tant'è vero che in questo contesto, replicando sempre la presentazione del mese della prevenzione alla Camera, abbiamo adottato un focus ancora più ambizioso, la prevenzione della malattia parodontale che in Italia è un problema molto diffuso, interessa il 60% della popolazione, di cui il 10-15% presenta una parodontite grave non trattata. Il relatore precedente ha già accennato alle importanti relazioni che esistono con certe malattie sistemiche e l'onorevole Tamburrano ha parlato di una visione olistica del paziente e sappiamo quanto sia importante e dobbiamo avere attenzione tra le correlazioni che esistono tra la malattia parodontale e le importanti malattie sistemiche, dove la reciproca influenza si sviluppa sia in ambito di patologia attiva sia in quello di remissione. E anche in questo ambito abbiamo sviluppato poster e contenuti multimediali informativi che continuiamo a presentare alla popolazione. Il tema dei mezzi mobili è un tema per noi molto importante, è un progetto che abbiamo realizzato con la Croce Rossa Italiana e con altri partner e questo porta a servizi di screening, assistenza, educazione sanitaria, è un ruolo operativo orientato alle fasce più fragili. In definitiva questo modello mira a portare la prevenzione dove non arriva e mira a creare fiducia e avviare percorsi di cura. Molto rapidamente, mi porto verso la conclusione della mia relazione, abbiamo altre iniziative locali e nazionali. Vorrei ricordare il progetto scuola in cui noi crediamo moltissimo, in quanto la prevenzione deve essere un appannaggio soprattutto rivolto ai bambini, ai più giovani individui che attraverso un'educazione alla salute nelle scuole dell'obbligo ci ha permesso di arrivare a migliaia di questi bambini sia con delle manifestazioni diciamo a macchia di leopardo sul nostro territorio nazionale, sia con delle organizzazioni diciamo definite a livello regionale, attualmente in corso in Toscana e Basilicata. Altri eventi che sono di interesse anche in questo contesto è l'Oral Cancer Day, per esempio, la Giornata Mondiale della Salute Orale che collega l'Italia a una campagna internazionale, il progetto Dentista Sentinella, che è un progetto dove abbiamo sviluppato una formazione specifica rivolta a tutti gli odontoiatri, non soltanto ai nostri associati, per il riconoscimento precoce dei segnali di violenza sia sulle donne che sui minori. Il progetto Federfarma è una collaborazione che è in corso con oltre 18.000 farmacie aderenti a questo circuito in Italia ed è un'attività evidentemente che permette in modo capillare di arrivare con appunto i dettami della prevenzione a livello di qualsiasi cittadino. Per ultimo, ma avremo altri progetti, ma il tempo purtroppo è tiranno, abbiamo una collaborazione con l'INMP, è un istituto del Ministero della Salute che si occupa della promozione della salute delle popolazioni migranti e contrasta le malattie della povertà e questo è un progetto che noi odontoiatri con l'INMP rivolgiamo alle gestanti in condizioni di vulnerabilità socio-economica. Infine, sottolineo che tutte queste iniziative sono state sempre svolte in piena collaborazione con tutto il mondo odontoiatrico, dove anche altre componenti associative, come l'Associazione Italiana Odontoiatri, qui rappresentata dalla dottoressa Marzia Segù, ci hanno aiutato nel successo di questi percorsi. Mi rimane che ringraziare tutti per l'attenzione e confermo l'allineamento di Andi con gli obiettivi condivisi del contesto odontoiatrico e istituzionale qui riunito. Grazie.
Thank you, Dr. Scafidi, for this very good presentation. Please allow me just to add a few words as comments on the first two speakers seen from the Danish perspective. We are the country in the world on the second place when we talk about sugar consumption. Only the United States of America have a position higher as Denmark, the country that I come from. I'm definitely, being a dentist, not proud of that. Dr. Scafidi, you said, if I remember it right, 83 grams. In Denmark, we are over 100, which means that every Dane eat more than 10 kilograms of sweets every year. So that's nothing to be proud of. And connected to the presentation from Mick Armstrong, we also had, and I'm very sorry to say, had a sugar levy in my country. The sitting government, we don't know how long because we had elections yesterday in Denmark, have decided to take away the sugar levy. So please, as a dentist representing Denmark, we have the second place in the world talking about sugar consumption. And now we even don't have a sugar levy. Can you see what the sugar industry are in for that? Sorry for this intervention, but it was so closely linked to the first two presentations. So let's stick to the agenda that I don't take away your time. So I will now give the floor for the chair of the CD Working Group on Oral Health Matters, Dr. Vasilios Statopoulos, for Greek national regional examples of oral health promotion and prevention programs. Please, Vasilios, take the floor.
Thank you, Mr. President. And just, let's say, 30 seconds to commend you as being in Denmark. Maybe you have a great consumption of sugar, but your DMT index is 0.4. And I think we should connect because we are dentists here. But anyway, I'm not I don't consider myself as an expert, as you mentioned in the beginning. I'm just a representative from Hellenic Dental Association, and we're going to discuss a few things and give you a holistic approach in tackling sugar. There is no conflict of interest in my presentation, and with a complaint. Definitely and undeniably, caries is the more prevalent NCD problem in this planet now. But unless there is a dentist in the panel, we hear how sugar can have an impact on diabetes, on obesity, on mental illness, on neurodegenerative disorders, but nothing about oral diseases. So I think we should work as dentists in a common presentation of problems with our medical doctors and the policymaker people that please place oral diseases not only in our present. But I'm really happy for being here, and I would like to thank Dr. Tamburrano for his invitation. And in fact, I would go on and mention that were not mentioned, and I think we have to, dear President, work on that. Even Tedros, the WHO director, when speaking about tackling sugary drinks and alcohol beverages, there is no dentistry in the field. Of course, there is mention, and we help the recommendation of World Health Organization about the amount that we should reach, decreasing the consumption, and if we would like to quantify that, is about 50 grams per day. Do you know how many countries are under that? Practically only the African countries. We have to think a holistic approach. So I think if we're going to tackle something, we need awareness of the public, and we should involve all the parameters. And when you are in a beautiful Greek beach, which you are all invited, and you have that coffee with 4 spoons of sugar, there is always a question, and you drink that in a duration of 3-4 hours, then it's a matter of culture and not of quantity, really. But let me give you the current practice and future perspective. I heard before about the month of prevention. We practice in Greece the year of prevention every year. Oops. Okay. Sorry. Just a moment. Okay. So, we think that the holistic process is necessary, and prevention should become a culture to the people and not only rely at each time maybe addressing one thing or another factor, but addressing the whole package. And we practice a lot of initiatives to raise public awareness about the importance of oral hygiene and, of course, dietary habits. And the most particular emphasis is seen, as you will see, from our interventions about sugar, which will really try to decrease the consumption. A key component of these efforts, of course, is the implementation of screening programs, especially in ages from 5 to 17, because this will be the generation that will hopefully encompass this paradigm in their life. And of course, in parallel, I'm sorry. And of course, there are a number of actions that we practice, and will be shown a bit later on. Of course, the production and dissemination of education material in each preventive program, either national-wide or in a regional area. And finally, the Hellenic Dental Association has maintained an active advocacy role, urging the government to increase the number of dentists in our national health system, because you realize that we had a 10-year financial strict period, and a lot of things have gone back. Oh, come on. I don't know what's the problem.
There is a delay. C'è un ritardo.
Oh, sorry. Thank you. So, some of the brochures, I highlight the main interventions. Of course, you will tell me they're all Greeks to you, but I have placed some titles, and the main themes that we tackle is sugar, energy drinks, and how to effectively brush the teeth. There are regional interventions in which, this is just one of them, and in which there is oral screening, there is dissemination of formative materials, and there are interactive games in order to familiarize young children with dietary healthy food, and also the brushing good practices. There are guides that are implemented, and this is, for example, for elementary school, where it is dealt with free sugars, hidden sugars, the relationship between oral health and general health, and what foods should be avoided. And there are national-wide preventive programs that Hellenic Dental Association has organized. This is, for example, one in 800 all-day primary schools and 150 schools of remote areas, because in these areas the problems are more difficult to tackle. There are rural populations with increased needs, and we should learn them more. And there is another program from the Ministry of Education that it is taught how to brush and how to have a healthy diet inside the classroom. And it is adjusted time through the school program from the early ages of the elementary school until 70 years old. Of course, the package, the context is different, and it's leaving that. Of course, there are prevention festivals, and through interactive games and through learning by experience, and we see that kids respond very well. Here we have the happy teeth and then unhappy teeth. We have a lot of recognition and trying to learn things, and they learn things. And still, again, as highlighting, the Hellenic Dental Association is visiting places that probably the healthy diet and the brushing is not the fair choice, like imprisonment facilities. And also we participate in its outreach excursion, like the International Fair of Thessaloniki, which is for Greece is the major international fair, and exhibitors coming from all over the world. And then we are here and disseminate pamphlets and all these things. In the same line, we organize events like the World Oral Health Day, in which, again, this year the theme was about sugar and its effects in general oral and mental health. And at the same time, there are displays in metro stations, in bus stations, in all traffic networks about sugar and how we tackle these things. So we are in a multifactorial efforts to educate the population. In the same line, the Greek government is in the right track, and starting with the school canteens, which, and we're talking to children about from 6 to 70 years old, they are not allowed to offer anything else but these things. You'll see there is no sugar, there are no saturated fats, there are no trans fats, and regarding the beverages, it's only water. And this is by ministerial decrees. So they're not allowed. Again, in the nursery schools, in the kindergartens, the ministry has issued some very specific regulations, what to be prohibited, what to be implemented, what to be avoided. And it's not only declarations, but we have inspections. Around 2/3 of these 7,000 kindergartens and nursery schools are inspected every year, and we are pleased to know that regarding the free sugars, almost we have compliance in 100% of these stations. Not only that, in all-day elementary schools that they provide meals, and they are distributed around 100,000 meals per day in the primary and secondary school in specific areas. SSBs are excluded, sugar is excluded, processed food are excluded. So we managed to have a new generation that at least from the 8 or 10 hours around that will be in a school environment, they will not have any chance to use a salty snack, use a sugar food, an energy drink, whatever. And there are some fruits, there are some goals have been succeed instead of going up in the obesity. We know it's a global issue, it's a European issue, and of course it is, or it was, a Greek issue. Now, from the COSI initiative, we hear that we have a reduction, a considerable reduction of about 6% in girls and almost 3% in boys with tackling the obesity also. Probably all these things are helping make the new generation more towards a more healthy diet. And of course, the obesity is also tackled by the Ministry of Health using, implementing a program with UNICEF and funded by a new generation about obesity, which has good results as we just hear. Now, adds an important thing. Of course, it's an important thing, and we have tackled that. And what is astonishing is when the young children were interviewed, why you use always salty snacks or sugar food, high-calorie items, and not using, let's say, fruits and vegetables, they said, we don't see an ad with vegetables and fruits, which is something that we should deal with that too. CED has issued a resolution in 2025. I think it is disseminated, and I just try to summarize the effects because we're not going to deal with the 14 recommendations, but I think time is pressing. So my last word is that we should make prevention the main strategy, and if we would like to succeed in this main strategy, I think we should make it more appealing to the population, and we have to make it as a culture. And I think the last 15 years that we are implementing these things, and of course the Greek state is implementing the meals and all these things, I think we'll have a new generation that will not depend on advertisement or prohibitions, but it will be a way of growing and knowing what is a healthy diet. Of course, healthy diet, as we know, is decreasing sugar consumption. Thank you.
Thank you, Dr. Statopoulos, for this very fine presentation. And yes, you are totally right. We have healthy teeth in my country. Among the children, we are on the first place, but Germany are moving closer. This is something to be proud of, not to thank God for, but to thank the dentist and the dental team for. So, we also have a problem in my country with obesity and heart diseases. So they are growing and growing and growing. So we still need to fight against sugar. And let's move on to an expert in periodontology, a disease very close linked to non-communicable diseases. What I even mentioned are growing, at least growing in my country. Also an expert in oral health prevention. And from the German medical faculty in Dresden, Dr. Wölber, please take the floor.
Thank you very much. Dear distinguished members of the Council of European Dentists, dear Dario Tamburrano, excuse me, ladies and gentlemen, it's an honor to see you, to speak to you in Brussels today about a topic that lies in the intersection of dentistry, public health, and human biology. The reduction of free sugars as a key strategy for oral and systemic disease prevention. The German Federal Dental Association recently issued a set of policy recommendations emphasizing sugar reduction and structural prevention strategies, what we call Verhältnisprävention in German. These recommendations place the reduction of free sugar consumption at the center of oral health policy. Today I would like to argue that this approach is not only justified, it is scientifically inevitable. Because when we look at the evidence from microbiology, clinical studies, evolutionary medicine, and public health, a clear picture emerges. Sugar is not merely a dietary component. It is, in its modern refined form, it represents a biological mismatch between our evolutionary design and our contemporary food environment. Oral diseases are the most prevalent chronic diseases worldwide. Dental caries alone affects billions of people. But the story does not stop in the oral cavity. High sugar consumption is associated with a wide range of non-communicable diseases, the main cause for premature death, including obesity, type 2 diabetes, cardiovascular disease, and certain types of cancers. By now, this is proven by high-class evidence based on umbrella reviews of systematic reviews. In other words, the same dietary factor that drives caries also contributes to systemic diseases. This insight is not new. Already decades ago, researchers hypothesized that excessive intake of fermentable carbohydrates could be a shared risk factor linking dental and systemic chronic diseases. Dentistry, therefore, is not standing at the margins of chronic disease debate. Dentistry is standing at the front line. To fully understand the role of sugar, we must briefly step back in time. From an evolutionary perspective, the human oral microbiome evolved in an environment characterized by whole foods rich in fiber, micronutrients, and complex carbohydrates. Dental biofilms themselves are not pathological. They are a natural phenomenon that exists wherever microorganisms colonize moist surfaces. For most of human evolutionary history, biofilms coexisted with a host without leading to widespread dental diseases. The dramatic increase in caries and periodontal diseases appeared only with the transition to modern Western diets, particularly high in refined carbohydrates and added sugars. In other words, the problem is not the existence of dental biofilms. The problem is the environment in which these biofilms develop. And that environment has changed dramatically over the last 2 centuries. Modern refined sugar is fundamentally different from carbohydrates humans evolved to consume. It is rapidly absorbed, fiber-free, highly concentrated, and often consumed frequently throughout the day. And obviously, people have difficulties to stop eating sugar. From a biological perspective, such a substance never existed in our evolutionary dietary landscape. So let us take a more closer look at the biological mechanisms. Sugar affects oral health through 2 interacting pathways, a local one via the microbiome, the oral, and a systemic one. Fermentable sugars are metabolized by saccharolytic bacteria such as Streptococcus mutans, producing organic acids, extracellular polysaccharides that enhance biofilm adhesion and acidification. Repeated sugar exposure leads to prolonged pH drops below the critical threshold for animal and dentine demineralization. This leads to both caries and gingival inflammation. Importantly, the frequency of sugar intake is just as important as the amount. But sugar affects also the oral tissues through systemic pathways. Rapid glucose spikes and hyperinsulinemia can induce inflammatory responses, oxidative stress, and heightened blood lipids. This metabolic inflammation contributes to gingival inflammation and periodontal diseases. Indeed, a systematic review of our working group and a meta-analysis showed that the restriction of free sugars significantly reduced also gingival inflammation, even when plaque levels remained unchanged. This observation challenges a purely plaque-centered paradigm. It suggests that diet can modulate the inflammatory response to the biofilm. One of the most fascinating demonstrations of this concept comes from experimental nutrition studies. In a controlled dietary intervention simulating pre-industrial diets rich in whole foods and low in refined carbohydrates, and participants stopped interdental cleaning, they developed more plaque but less gingival inflammation. In other words, plaque increased, but inflammation decreased. This paradox illustrates an important principle. The biofilm itself is not the problem. The pathogenicity depends on the ecological and nutritional environment. Diet can therefore transform the oral microbiome from a health-associated ecosystem to a dysbiotic one. Despite the scientific evidence, sugar consumption in Europe remains far above the recommended levels, as we have heard. The World Health Organization recommends limiting free sugar intake to around 25 grams per day, especially for oral reasons. And yet the average consumption in many countries exceeds 3 to 4 times that amount. In Germany, for example, average sugar intake is roughly about 19 to 100 grams per day. This discrepancy highlights a fundamental problem. Individual behavior alone cannot solve this issue. The modern food environment promotes sugar consumption through availability, marketing, pricing, and product formulation. This is precisely why the Bundeszahnärztekammer emphasizes structural preventive strategies. Recent policy analyses showed that voluntary reduction strategies by the food industry often produce only minimal changes. For example, the German National Strategy for Sugar Reduction in soft drinks led only to a 2% reduction in sugar content, far below what was targeted and far below what was achieved in countries with regulatory measures such as sugar taxes, as we have heard from the UK. This evidence suggests that structural interventions, taxation, reformulation, policies, labeling regulations, marketing restrictions are far more effective. Dentistry should therefore actively support these public health strategies. Dentists occupy a unique position in healthcare. No other medical profession sees healthy individuals as regularly and as early as dentists. The dental practice is therefore a critical point for early detection of nutrition-related disease nutrition patterns. Changes in gingival inflammation or caries activity can serve as early warning signals of metabolic and nutritional imbalance. This gives dentistry a powerful opportunity, not only to treat disease, but to identify and address its underlying causes. The Council of European Dentists has the opportunity to play a crucial role in this transformation. Dentistry can advocate for policies that reduce free sugar consumption, support healthier food environments, strengthen preventive healthcare, integrate oral health into broader NCD's prevention strategies. And this aligns perfectly with a common risk factor approach, recognizing that oral health diseases share the same risk factors with many systemic diseases. So let me conclude with a simple but powerful idea. For decades, dentistry has focused primarily on managing the consequences of sugar consumption. But the time has come to focus on the reduction of the cause. Refined sugars, consumed in large quantities and isolated from its natural fiber matrix, represents a biological novelty for Homo sapiens. Our microbiome did not evolve for it, our metabolism did not evolve for it, our reward systems did not evolve for it, and our health systems cannot sustainably manage its consequences. Reducing free sugar consumption, therefore, is not only a dental recommendation, it is a fundamental preventive strategy for human health. And dentistry has both the scientific evidence and the societal responsibility to lead this change. Thank you very much.
Dankeschön, Dr. Wölber. And you are totally right. As long as we have the dentist and the dental team, diet is maybe a bigger problem for the health, the general health, as for the teeth. But money can only be used once. Why use a lot of money paying dentists for fighting against caries and other diseases linked to the consumption of sugar? Isn't it clever in a time where we need to use money for everything else in the world to focus more on the reason we need to lower the sugar consumption? So thank you very much, and let's wrap up the presentation from the perspective of dental professionals, and particularly the French perspective. Dr. Charlotte Oyes, please take the floor.
Thank you. Thank you very much, Mr. President. And it's a great pleasure for me to present you the new oral health prevention strategy in France, aimed at creating a new generation of children free from tooth decay. We call it Génération sans caries. According to the last National Oral Health Survey from 2006, the DMFT index at age 6 is 1.3 and at age 12 is 1.23. We know that it has been steadily declining over the past few decades. We know also that 63% of the 6-year-old children and 56% of the 12-year-old children are completely free of decay. But behind these rather positive figures lies a much more mixed reality. Children from socio-economical disadvantageous backgrounds represent actually almost 50 to 60% of the tooth decay experienced in France. There is therefore a phenomenon of tooth decay polarization in France, making it socially determined disease and concentrate amongst the low incomes and least educated segment of our society. It is within these same population groups that we observe early childhood decay. This very highly invasive and destructive cavity affects 11% of children aged between 2 and 4 years old, leaving them in situations of suffering and social stigma until the permanent teeth have come in. Tooth decay is now a social marker linked to dietary habits and oral hygiene practice. Oops. Sorry. Yes. Furthermore, this non-communicable disease shares common risk factors with other diseases such as diabetes, cardiovascular disease, and obesity. These risk factors are a diet high in free sugars and unhealthy lifestyles. This condition involves not only an increasing number of adults, but also children and adolescents across Europe and in France. According to Eurostat, the prevalence of diabetes increased by 22% in 10 years and affecting now almost 8% of the European population. And according to the OECD's 2025 report, 9% of children suffer obesity by 2025, while 20% of teenagers are currently overweight. Moreover, this chronic disease represents a major economic burden in France and in Europe, with cumulative healthcare costs reaching approximately 10 of billions of euro per year. This convergence underscores the importance of integrated prevention approach to reduce exposure to sugar, which is the common risk factor. For this reason, the French government introduced in 2012 a soda tax on sugary drinks. This tax applies to soda, flavored waters, and fruit juice with added sugar. The price of this beverage was increased by 3.58 euros per hectoliter. The aim of this legislation was to influence the consumption habits of our fellow citizens. However, from a public health perspective, this measure is not the only one that had been considered to curb the epidemic of chronic non-communicable disease caused by excessive sugar consumption. 4 parliamentary proposals were examined by the French parliamentary between 2024 and 2026. The last, presented in February 2026, aimed to ban added sugar in infant milk. It is also with this goal in mind that our profession, with the support of the French health insurance system, has taken on the challenge of prevention. As part of the agreement signed between dentists and the French health insurance system in 2023, we established new guidelines for preventive care. The examen bucco-dentaire is an annual dental examination free of charge for the patient. This checkup is recommended to all children between 3 to 20 years old every year. This exam is recommended to children from 3 to 20 years old for every year, and the full cost is covered by the French health insurance system. The young patients can receive treatment and preventive advice. The cost of the examination is between 40 and 54 euro if radiology is required. Furthermore, preventive treatments such as sealant and fluoride varnish are fully covered during the 6 consecutive months following this consultation. All dental treatments resulting from this checkup are fully paid by the French health insurance system directly to the dentist. Finally, we cannot discuss prevention and public oral health without mentioning the essential role of fluoride in the remineralization of carious teeth. Prevention strategy evolved throughout the 20th century, shifting from large-scale prevention towards more individualized and targeted approach in order to reduce the population exposure to the risk of overdose. The use of fluoride toothpaste, as well as fluoride varnish and sealant, are essential elements of primary prevention in dentistry. We feel very concerned that the potential classification of fluoride as CMI by HECHA could lead to a misunderstanding among the general public. And in conclusion, not very too late. In conclusion, I would say there is no single solution when it comes to preventing chronic non-communicable disease such as tooth decay, diabetes, and cardiovascular disease. Only an integrated approach that combines reducing exposure to the main risk factors such as sugar with healthy lifestyle habits can reduce the impact of this disease on our young and elderly patients. And thank you so much for this moment. Thank you. That's all.
Thank you, Dr. Hoyes, from these insights from France and for giving an example of recent developments on sugar regulation in your country. Overweight, diabetes, and heart diseases are all linked to sugar consumption. The oral diseases can maybe be controlled by dentists and the dental team, but they are too expensive. We need to take care of the sugar consumption in the future. So, and with those words, I will like to hand over the words for our next speaker. And this is Anouk Guillou from the NGO Safe Food Advocacy Europe, who will give a different perspective, sugar from the side of the European consumer rights. And I will, of course, also like to take the opportunity to thank you for accepting to participate in today's event and bringing your expertise. Please take the floor.
Good morning, everyone. Thank you so much. Thank you very much for the invitation. It's a pleasure to be here today. My name is Anouk Guillou, and I represent Safe Food Advocacy Europe. I would just like first to thank the previous speakers for those very insightful presentations, and I think I heard very keywords and concerns that I would like to go back to from your side, just mentioning prevention and raising awareness and this concern about reaching the maximum amount of people. Also that oral health is a question of equality. I think this is a very strong point as well. A holistic approach was mentioned as well, and hidden sugar, which I will talk about a bit afterwards. That individual behavior alone cannot solve this issue. I think this is a very strong point as well. And the fact that those diseases are socially determined. And all those concerns and keywords, hearing those make me think that our work, so yours and mine, makes sense, and that there are a lot of synergies. So today I will talk about excessive sugar consumption and health risks for European consumers, and hopefully what we can do about it. I will briefly introduce SAFE and our work, then our activities and achievements within EU-funded projects, collaboration and best practice that we put forward, and finally conclude with concrete policy recommendation at the EU level. SAFE is an independent, non-profit organization representing European consumers on issues related to food safety and agriculture. Our mission is simple, to protect and advance consumer rights within EU food policy. We do this through advocacy and policy work to strengthen EU legislation, raising awareness and training consumers, and leading EU-funded projects across member states. We currently bring together over 40 member organizations across 17 countries, including national consumer organizations, health organizations, vegan and vegetarian organizations, and associations working on nutrition and obesity. We represent European consumers on the EFSA Management Board too. So a little word on our funding, because this is also important. We are funded by different types of EU projects. We receive an operating grant under the European Social Fund, and we are currently involved in 13 EU-funded projects, among which 12 are Horizon programs, and one is financed under EU for Health. Health is one of SAFE's 3 core pillars, alongside environment and inclusion. We advocate for healthier food environments because individual choice alone is not enough. This includes calling for stronger regulations on marketing of food high in fat, sugar, and salt, especially towards children and adolescents, and reducing excessive levels of sugar, salt, and fat in food products in general. I will present some of our EU projects that are relevant for today's topics. One of them is funded by the European Social Fund, and it's called Food for Inclusion. With this project, we have delivered food literacy trainings to over 5,000 pupils across 10 member states. We have 2 types of trainings. One of them is about the health impact of excessive sugar consumption, including links to tooth decay and non-communicable diseases. We help them understand the different types of sugar and calculate their daily intake and compare it to the recommendations of the WHO. The other one is about packaging and labeling, and it helps children recognize ultra-processed foods and HFSS products. We help them build practical skills like reading labels to identify additives, sugar quantities, and identifying marketing tactics as well. They are very interactive, there are videos, and we do games with them, so we really engage with the children directly. In the framework of this project, SAFE also published a report on HFSS food marketing targeting children. With this report, we analyzed practices in 7 countries, which are Spain, France, Denmark, Ireland, but also outside of the EU. We analyzed practices in Canada, Chile, and in the UK. The country analysis showed that approaches to regulating HFSS food marketing to children differ widely between countries, especially in terms of age limits, restricted TV advertising hours, targeted media, and enforcement. A lot of European countries continue to rely on a small number of rules or voluntary self-regulation, as seen in Denmark, France, Spain, and Ireland. In these countries, industry-led codes mainly regulate non-broadcast and digital marketing, such as Denmark's Code of Responsible Food Marketing or France's Charte Alimentaire. These codes are voluntary and depend on industry compliance, rather than legal enforcement, and they sometimes exist alongside limited mandatory rules focused mainly on traditional media or specific settings like broadcasting or school zones. In contrast, mandatory laws are usually fewer but tend to be more robust and effective. Chile has implemented extensive restrictions on unhealthy food advertising across different types of media with effective enforcement. They also enforced food front of pack warning label, serving as an example of comprehensive mandatory system. The UK has established specific legislations, including restriction on advertising HFSS products, banned online advertisement, and introduced a 9 p.m. watershed since very recently, January 2026. The UK also introduced product placement measures, restricting placement of HFSS food in checkouts and end-of-aisle display. Our findings are clear. Voluntary self-regulation is not sufficient, especially in digital and general audience media. Children remain heavily exposed to unhealthy food marketing, which calls for binding and comprehensive EU-level regulation. I have some copies of this report with me if you want to check it out at the end of our meeting, but we will publish a new version very soon with updated information on the most recent measures at the EU and outside of the EU level. SAFE is also coordinating Prevention, an EU for Health funded project. Its objective is to reduce the burden of non-communicable diseases while addressing health inequalities across Europe. Over the past 2 years, we have worked with schools, migration centers, medical institutions to deliver targeted programs to promote health equality and disease prevention. A key focus of prevention is working with children in vulnerable situations, which have been mentioned in earlier presentations. We have trained over 500 pupils in schools located in disadvantaged areas across Croatia, Lithuania, Greece, and Italy. The project is targeting also displaced Ukrainian children. These trainings focus on empowering children to make informed choices on the two same topics I mentioned earlier. So one of the training focuses on excessive sugar consumption and the other one on labeling and packaging. To complement education, we also developed a digital tool, Bite Watch. This is a free application that allows consumers to scan food products and instantly understand their nutritional content. An essential feature, and important for our topic today, is that it converts sugar content into teaspoons, making it much more tangible and accessible, especially for vulnerable consumers. So as you can see on the slide, there is a color-coded scale with those sugar teaspoons, and so you know that when it's red, it basically means that it's high in sugar. And there is this specific sugar tab where you can also see the recommended amount of sugar, daily intake of sugar by the WHO. I warmly encourage you to try it yourself. It is available on our website. There is a link, but you can also directly download it on Apple Store or Google Play. Addressing sugar consumption requires collaboration and strong collaboration. SAFE is actively involved in coalitions such as Food Policy Coalition. The Food Policy Coalition works towards policy integration and alignment at the EU level to facilitate the transition to sustainable food systems. It provides the debating space to discuss policies and sometimes carry out joint activities. We are part of a task force that focuses on food environments, where we worked with organizations such as the European Heart Network, the European Public Health Alliance, European Public Health Association, Association of European Cancer Leagues. And why I'm mentioning those organizations is to show you that we don't only work with food experts and environmental organizations, but also health organizations. There is also a project funded by the Foundation Healthy Food, Healthy Planet, where we also work alongside both environmental and health organizations. The long-term objective of this project is that the EU enacts binding policies that make large companies accountable for the health and sustainability of the food they sell to consumers. Why I mention these two, collaboration and initiative, is because these alliances bring together experts from public health, cardiovascular health, and environmental sector, where we discuss key topics such as the excessive sugar consumption and best practices. We really adopt an integrated approach, so environmental, social, economic, and sustainability dimensions are taken into account when we tackle health and food policy. One key example of best practice we promote is the sugar tax that is implemented in the UK. And why? Is because this model is effective because it targets producers and not consumers. It incentivizes reformulation from the industry side, and it reduces sugar consumption without increasing inequalities. This is exactly the type of structural measure we need at the EU level. So what can we do about excessive sugar consumption for European consumers? First, alignment is crucial. Civil society organizations and healthcare professionals, just like you, must speak with one voice. And also, we need some EU policy action. We need to promote taxation model inspired by the UK sugar tax in Europe. We need to establish a clear and harmonized definition of ultra-processed foods. Implement an EU-wide ban on marketing of HFSS food targeting children. Regulate product placement at retail level. And invest, obviously, in education and public awareness campaigns. Because without structural measures, we will not achieve meaningful progress in reducing sugar consumption. To conclude, reducing sugar consumption is not only a matter of individual responsibility, it is a policy challenge. And as we like to say it at SAFE, without information, there is no choice. So we really need to focus on education. It is essential if we want to improve both oral health and overall well-being in Europe. Thank you very much for your attention, and if you have any questions, don't hesitate.
Thank you, Ms. Gilliu, for giving your view and recommendation from a very important consumer perspective. I couldn't agree more. Stronger collaboration between civil society organizations and dental profession is essential, because sugar is a problem, and it's not only a dental problem. It's a problem for the general health, and with a growing elderly population, it will, over time, because it's so close linked to non-communicable diseases like obesity, heart diseases, and so on, it is a threat to public finances. So we need to switch strategy to prevention and promotion of health, of general health. And we have, God thanks, more tools than only going to the dentist and the dental team to take care of the consequences of a high sugar consumption. Of course, we can cure doing treatments. Of course, we can, on an individual level, do the very best for all our patients. But if we really care about civil society, about the money that we need to use in the future, not only for oral health, but for general health, then we need to go for more promotion. And we have tools. We have tools. I totally agree. We have a sugar tax, or a sugar levy, if that's a better word for that. We can fight against ultra-processed foods. We can ban marketing. We can go for legislation and of product placement. We can, of course, also, as you said, go for educational campaigns and public awarenesses. We have a lot of tools if we stand together, but we need to make the politicians that take the decisions aware of this severe situation that we stand in, not for the sake of the dentist or the dental team. If they do nothing, if they really do nothing, who earns the money here? Please understand, we stand together. We need to save the money that we use, because we need to use the money for something more important, as caries and other oral diseases, obesity, heart diseases, so on. I really don't understand why it's only us that can understand that. As again, I come back to my own country. They are crazy, taking away sugar levy in the country with the highest consumption of sugar in the world. Only the US, but I mean, US, let don't start a discussion on that for now. From a European perspective, we shall maybe put that out. But I really don't understand why they cannot see exactly as Mick said. We need to fight. We need to fight against sugar consumption. So I will now open up for discussion, and please be aware of that this session is also live streamed. So there can also be comments from the outside. And as I also said at the beginning, there will be a link to a YouTube presentation later that we really can stand together and fight against sugar. So I please open the floor for any comments, discussion, everything that's important. And I can start with you, Mick, and then I can go on from down there. Please, Mick.
Can I just say, we must not underestimate the power of the sugar industry. Anouk referred to legislation recently brought in about watershed advertising, product placement, things like that. They have subtly already, since January, restructured their advertising campaigns to find loopholes in that. And it is an absolute scandal and a disgrace that they are allowed to do that. So it took a long time for the tobacco industry to be painted as bad boys. We need to start on the sugar industry big time. And Freddie doesn't want to engage with America, but we must, because the biggest culprit is Coca-Cola, based in America. When you've got the biggest idiot in the world standing up in the Oval Office saying, I drink 6 cans of high sugar Coke a day and it must be real sugar, what chance have we got of competing with that? And I really do think that the EU are probably one of the few bodies that could do that by passing significant legislation to restrict the activities of these countries. So I urge you, although we're not part of it, to please get on and do it.
So thank you, Mick, and then please.
Hello, good morning to everybody. This is Alessandra Rossi from Andi, Italy. Thank you for the very, very interesting morning, and we heard a lot of words. And I just wanted to focus on one point. We have a lot of tools we should work, but I've heard this morning something very interesting. We can have another tool is advertising on healthy food. Let's take it the other way around. Let's improve. This is a proactive approach and stress the advertising on healthy food. Let's make it on the other side. Make the kids watch and see the alternative we can have. So instead of banning, which is very difficult, instead of banning, going against, let's take another step. Let's take it on the other way. Let them see what they can have as an alternative. Healthy food, good food, no sugar. Okay? Thank you.
Any more comments for now? Have we anybody online? Yeah, please.
Thank you. I think Alessandra's point is excellent. I just mentioning as a complaint of not being ready to respond. And I saw Mick showing the package. I don't think that these photographs have really worked. They have worked, of course. What I mean is they tackle the cigarettes and maybe the cigars. But today we have new products. And I think the industry is not only clever and it's not only one step ahead. I just have learned that in Greece we are not producing sugar from canes, but stevia plants are growing rapidly. So instead of hitting the cigarettes and having nicotine patch, areca, whatever other things, let's find out or having in mind that it's not only to hit sugar, but be prepared for the next step, which I think are other substances to get involved. So I think industry is, as I said, one step ahead, and we have to think out of the box and think for the future. Thank you.
Anybody else who want to comment for now? Yeah, please.
Allora, considero la giornata veramente molto produttiva perché ho ascoltato delle considerazioni estremamente importanti. Ringrazio Alessandra perché mi ha accompagnato prima di tutto e poi ha fatto un'osservazione di grande interesse. Effettivamente ribaltare questo discorso del marketing attenzionando appunto l'interesse del cittadino verso i cibi salutari è un ottimo inizio, è un qualche cosa che deve essere assolutamente preso in considerazione. Certamente il ruolo delle industrie è un ruolo molto pesante. Ho ascoltato che in diversi paesi la legislazione, la normativa ha qualche difficoltà perché ci sono delle presenze e delle pressioni lobbistiche, come nel mio paese, che appunto vede la sugar tax passare di anno in anno nella sua applicazione, proprio per queste problematiche, come se la salute delle persone fosse meno importante di quanto non sia il denaro. In realtà purtroppo questa è una triste verità. È il motivo per cui il mese della prevenzione, che ho cercato comunque di portare ad un livello, dal mio punto di vista, superiore rispetto a quello che la tradizione ha voluto, che si svolge non soltanto a ottobre, ma in ottobre noi concentriamo, per ragioni evidentemente anche di tipo economico, la nostra attenzione mediatica verso la popolazione, ma il mese della prevenzione è l'anno della prevenzione, tutti i giorni si fa prevenzione. Ma quello che io ho voluto inserire quest'anno, non con poche difficoltà, che non vi sto a dire, ma legate magari anche all'industria da questo punto di vista, è verso il problema della malattia parodontale, perché è l'elemento che come dire, ha sensibilizzato più pesantemente la nostra politica per le forti correlazioni che esistono tra la salute orale e la salute dell'organismo e le reciproche evidentemente interazioni che esistono sia in senso negativo ma anche in senso positivo. La politica da questo punto di vista è rimasta fortemente colpita, tanto è vero che dal punto di vista aneddotico mi piace dire che quando noi abbiamo presentato il mese della prevenzione alla Camera quest'anno, nella seduta plenaria, nella big aula della Camera, si parlava della guerra in Israele e della guerra in Croazia, attraverso appunto i relatori, i nostri ministri relatori della difesa e degli esteri. Eppure avevamo la nostra sala piena di deputati dell'arco, come dire, trasversale del Parlamento, che erano molto interessati a questo tipo di argomento, e questo mi ha fatto molto piacere, perché evidentemente è lì che noi dobbiamo sensibilizzare le nostre politiche a livello dei decisori politici, che sono gli unici che possono confrontarsi con il marketing, con l'industria, e quindi cercare di trasformare il diritto alla salute attraverso una applicazione giornaliera, personale e chiaramente organizzata a livello nazionale, a livello politico, attraverso la prevenzione. Grazie.
Thank you, Dr. Scafidi. Anybody else here who wants to comment? You can still think, because I have a comment here from Harisam Eselikovic, and I just read it here that you all can understand, and then we can find out who wants to answer. We do know that we need upstream interventions to promote oral health, including the use of sugar. These interventions will also reduce inequality. Could I have a feedback on that? So now we open up. It's not only a problem about diseases and how to control. This is also a discussion about inequality. Anybody who wants to comment on that? Don't look like that, then it's up to me, I think, and I can only agree with Harry Sam. We need to change strategy. We need to fight more upstream. And why? Because I don't think there is a disagreement in this room. I fully understand that fighting the sugar industry cannot stand alone. They have too much money. This is a battle that we have lost. I think you all know that in many kinds of foods that we eat, there are substances in there that goes directly into our brain saying, I will have more of that. The money that the sugar industry invests in that are so high because there's so much money in there. It's totally the same if you go to the internet. Why do all those actors there will have us to click on something? They don't want us to leave. So of course the producers of sugar and sweets and everything out there want us to buy more. Exactly the same as what we have seen, as Mick said and others said, in the tobacco industry. So why don't people change attitude? I mean, there's nobody out there that doesn't know that sugar is not good for your oral health. There's nobody out there that doesn't know that it's not good for your general health.
I don't agree.
Yeah.
I think when you're talking about inequalities, those people may or may not know that, but some don't. And the level of oral health literacy across the board needs to be raised. But equally, even if they know it, they have no choice but to buy cheap, ultra-processed foods because of the price. And unless that deprivation and poverty needs addressing in so many more ways, and just giving them the information doesn't do it. So that's a societal problem. I still think the answer lies in legislation. You cannot take the sugar industry head on in any reasonable way with a balanced argument. It just doesn't work. They're too clever, too criminal in their approach to making money. The only way you can do it is to legislate against them.
If you hadn't interrupted me, you had been hearing me saying exactly your words, my friends. So I don't want to repeat them. This was my final words, but I can live with that, Mick. We are going hand in hand. We are fighting totally the same. So exactly my words. We need to do both because people know it. Some maybe more or less than others. I fully understand. But why don't we change attitude? Exactly as Mick said, because that's what we are fighting against. They are clever and have more money than we have brain. Yeah, Christoph, please.
Sugar industry has a lot of money. So I think we have to bring other weapons into this battle. The CD family has 350,000 dentists. These are 350,000 multipliers. So if we give all the dentists the information, then they give it to the patients, we can reach a lot of people and a lot of millions. And maybe in this way we can be a little bit equal to the money of the sugar industry.
Dr. Welber?
Thank you very much, and I absolutely agree with this point. But I think we also have to step one step forward in the dental practice, because the story is not enough to tell the patients that it's a problem of oral health, oral hygiene, or the use of fluorides. So we have to address diet. So if we don't do that in dental practice, we leave this chance out to absolutely address this point for all the people.
I meant this, that we have to give the information to
Hans, please.
Yes, it is. Thank you. If you look at this complex phenomenon, then you could talk about the sugar industry as an industry of addiction. It's a different morality. And if we look, I completely agree with the story Mick told us. Tobacco, 25 years ago, the investors in tobacco took into the region of sugar industry because that was an addiction which was becoming more and more allowed. It is not allowed, but by law it is difficult tobacco. Although the last 5 years you see a tremendous rise of using of vapes, which is also a very negative idea, I think. We talk all the time about oral health care. I think indeed should be part of healthcare in total. And it is in the Netherlands, at least, the Ministry of Healthcare who is, in a way, responsible for healthcare. But isn't this something for the Ministry of Education, Culture and Science? Because there are so many people who don't learn the backgrounds of food and healthy living. I don't blame the elders or people who take care of the children. I think there should be a peer group around these children on schools who, I would say by law, there has to be an obligation to learn them healthy living and lifestyle, and food is a part of that. This is, of course, something we as dentists, 350,000 dentists in Europe, we can do a lot. But it's very difficult to fight against the peer group of youngsters in our society. Thank you.
Thank you, Hans. Can I maybe borrow your packet of cigarettes? Can we agree that information alone doesn't work? Nobody takes a cigarette in his or her mouth without seeing messages like this on a tobacco package. So nobody knows that there are not disadvantages here. Why do people still smoke? It's addiction, my friend. That's what we are fighting against. So I totally agree, Hans. We need to do more because this doesn't work alone. Thank you. Yeah, please.
I think I disagree and agree on some points with you, but because I think information is extremely powerful, and why I'm saying that is because I really want to emphasize the role and the importance of the EU projects that I presented earlier, because they really focus on education, and one key aspect of those projects is that they focus on disadvantaged populations, whether it's migrants, whether it's in disadvantaged areas in general, and those trainings that really teach the how to measure sugar in the products to children. And I personally taught those trainings, so I know what I'm talking about. It's very impactful. The children do understand what we're talking about, and then when they look at their snacks that they're going to get in the afternoon after our trainings, they look at the package and they actually understand what it means when sugar is the first ingredient in the ingredient list. And this is so important because it does have an impact on their health and on their oral health. And obviously we talk about addiction as well. We teach them. So basically, we ask them, like, why do you think you want to eat the whole pack of chips at the end? Or what do you, if we talk only about sugar, why do you want to eat all the pack of candies and not just one? And they're very, they do react to those information, and I think they take away this message home. Of course, it has to be scaled up. It has to be, we need more than this. We need a holistic approach, but this is one of the tools, if I want to be a bit positive, that does have an impact.
Yeah.
Hi. I think you said a magic word. You talked about children, so that's the point. We have to work on children, and I think we have to work. That's why that's the difference. Freddie just showed a packet of cigarettes, and usually cigarettes are taken by adults. The adults are already addicted. They're addicted to smoke, they're addicted to sugar. We have to work on children. And another thought I made, we have to work on the teachers, on the people who raise children to improve their education on these subjects, because they're the ones. I remember my eldest son coming back from school, while he was washing his teeth, closing the water tap because his teacher told him that's a way to save water. And so teachers in the childhood age have really a powerful effect. So we have to work on who is raising our children to. To improve the education, we have to look forward on what they will be, and that we can work on it so they won't be addicted as we are to sugar. Thank you.
Thank you, Alessandra. You are totally right. Fighting against addiction is maybe really the right tool that we shall use here. So please.
I wouldn't agree more with Alessandra. Some of the projects I saw you in my presentation about national wine campaigns are not done by dentists. The paradigm is there are volunteer dentists that, let's say, educate the teachers in the primary school and the secondary school, and then the teachers taking time and, of course, the acceptance of the Ministry of Education, and teach the children how to brush or speaking about healthy diet. This is a population that we're not going to see, let's say, results in the next year, but we will see definitely results in maybe 5 or 10 years. So as a long-term perspective, our approach would be the power and campaigns to the public, and especially the persons that they will take the information and keep it and then use it in the past, and these are the children. It will take time, but this is a very steady step. And I think we have good results. Unfortunately, in Greece, we don't measure things. We don't have data. Probably, if we had data, would seem that the young children are becoming better than us, our generation, I think. This is the way to go, long term, of course.
Very good words, because I totally agree with you. If we can say that we need to fight against addiction, we have a way forward. Because what do the sugar industry want? What do the social media want? What do the tobacco industry want? Addiction. Because if they have addiction, they earn money. So we need really, as you said, Alessandro, take care of the children that they are not getting addicted. I couldn't agree more. Because if you first are addicted, this was what I was trying to say, then even if you know that it's not good for your health, you will still go on smoking, eating too much sugar because you are addicted. And that's the reason why I totally agree with Mick. We need to fight the sugar industry because they want us to be addicted. Please, Mick.
By addiction, I'm not a scientist on addiction, but I think the pathway, if we talk about sugar addiction, it's different to, say, nicotine and alcohol. It's not the same type of addiction. So I think if we're going to use that word, we probably need a bit of science behind it.
Please, Scafidi, Dr. Scafidi.
Allora, il discorso che ha fatto Alessandra, avendo una forma mentis evidentemente simile, mi trova perfettamente d'accordo, che poi è l'attività che noi svolgiamo. L'informazione che noi diamo alla cittadinanza diventa formazione per l'organismo, per il bambino in età evolutiva, per cui noi spendiamo molto della nostra attività nelle scuole e costringiamo, io personalmente costringo le aziende dell'oral care a finanziare questo tipo di attività e ad aiutarci in questo senso. Anche perché i bambini diventano poi facilitatori della prevenzione, diffusori della prevenzione anche verso i genitori, quindi verso gli adulti. Per quanto riguarda gli adulti, il problema della dipendenza è un problema reale, è un problema descritto dalla letteratura, che si conosce forse meno rispetto alla dipendenza dal fumo, ma è comunque una realtà che esiste e che deve essere affrontato. Ci sono altri strumenti che noi possiamo utilizzare verso gli adulti. Questi strumenti potrebbero essere non soltanto di tipo informativo, ma anche degli strumenti volti a modificare le loro abitudini. Vorrei portare qui un esempio che noi nella nostra associazione svolgiamo, in quanto noi abbiamo un nostro fondo sanitario integrativo privato. Tenete presente che la sanità odontoiatria in Italia, malgrado abbiamo un sistema sanitario nazionale che funziona molto bene, per quanto riguarda l'odontoiatria pubblica fornisce veramente delle risorse molto limitate. Sugli 8-9 miliardi che è il giro economico di cura odontoiatrica in Italia, soltanto l'1% viene fornito dal sistema sanitario nazionale. Si parla quindi di 75-80 milioni di euro ogni anno. Per la gran parte, per un 80%, le prestazioni sono cosiddette out of pocket, quindi il paziente se li paga di tasca propria, e la sanità integrativa interagisce in questo ambito per un 8-9%, con una tendenza nella crescita. Cosa abbiamo fatto noi con il nostro fondo sanitario integrativo? Abbiamo introdotto un sistema premiante nell'assistenza sanitaria, per cui il paziente, l'assistito che dimostra di fare prevenzione e di sottoporsi a controlli regolari dal dentista, l'anno successivo, gli anni successivi, può avere un'assistenza in termini di prestazioni superiori all'anno precedente. Questo mi sembra un altro tentativo per modificare la mentalità delle persone e inserire al loro interno quell'algoritmo che permette appunto di pensare alla prevenzione come il tassello fondamentale della sostenibilità delle cure.
Thank you, and please, Dr. Welber.
Yeah, thank you. Mick, I absolutely agree that we have to do more science on the addiction component of sugar consumption, because there isn't so much literature on this topic, but we clearly see that sugar consumption goes along with dopamine secretion in the brain, so people get rewarded for eating sugar, and this leads to more overconsumption. And we just finished a study asking 55 students of dentistry to stop eating sugar for 1 month, and they started with really lot withdrawal symptoms. So everyone can check it out for yourself. Just leave out sugar for 1 month and you can check if you have withdrawal symptoms or not. This is quite easy to do. It's a self-experiment. But the good sign is that these withdrawal symptoms constantly got down. So in my opinion, it takes 6 weeks to get free from sugar withdrawal symptoms. So then you're sugar-free without any symptoms anymore. Thank you.
I totally agree, and Mick, you are asking for some scientists who have been doing work on that. I can deliver him. I can deliver him, maybe not in English, but in Danish. His name is Niklas Brennborg, and he had brought out a book, it's not so long ago, who exactly says what you have been seeing here, Dr. Welber. He had made this experiment on himself. He can make a wonderful presentation to show you on a scientific level that sugar addiction is exactly the same as addiction to drugs, alcohol, and tobacco. I would be happy to deliver this. I have a name. So, anybody else? I cannot tell you the title of the book because I'm not able to translate the word to English. But I would be happy to deliver you information on that later. Then you can maybe use Google Translate to read the book, or we can pay him money to tell you that exactly what Dr. Welber is saying is true. So So, and please welcome back. I know you went out for urgent reasons. So we are now getting close to an end. What you missed, you can of course pick up on YouTube channel afterwards. So I just once again want to thank you so much for personally and with the left group hosting this meeting, giving us an opportunity to tell how we see a future with less sugar consumption. Please, Dr. Tamburrano, take the floor.
La questione dello zucchero, noi che siamo dentisti, e credo che la sentiamo non solo da quando eravamo bambini, ma tutto il nostro percorso professionale, ho appreso che ci sono comunque delle novità legislative sia a livello europeo che a livello, diciamo, europeo più esteso, come in Inghilterra era proprio stato quello il tentativo del governo italiano in passato di seguire comunque l'esempio inglese. E quindi rinnovo comunque la mia disponibilità a lavorare sui processi legislativi europei in termini di salute pubblica, semmai ci dovesse essere qualcosa relativa alla questione dello zucchero o comunque qualcosa che può essere sfruttata per inserire la questione dello zucchero, perché a volte comunque vi sono delle proposte legislative dove alcuni temi non sono esplicitati e magari con degli emendamenti concordati anche con gli altri gruppi forse riusciamo a inserire qualcosa di più focalizzato, di più specifico. Questo se avverrà negli anni futuri o nei mesi futuri, io sono chiaramente a disposizione, io sono in Commissione Sanità anche, sono anche in Commissione Energia ed è il motivo per cui sono uscito, perché insomma il contesto attuale porta comunque a doversi posizionare sul futuro energetico dell'Europa. Però stando in Commissione Sanità chiaramente se arriva qualcosa io comunque la seguirò e semmai per qualche motivo mi dovesse sfuggire magari segnalatemela, quindi insomma fino al 2029 sono qua. E grazie ancora della presenza e mi sono un po' anche emozionato di aver passato la mattinata con dei colleghi e speriamo di rivederci presto.
Grazie.
So friends, thank you very, very much for joining this event. And as we started, dentist, we are future. You are never a former dentist. You are a dentist for your lifetime. But there is also history linked to dentistry. So the Dutch Dental Association years ago made a book, The History of Dentistry, in 256 prints. Maybe it also could be interesting for you as a dentist to take a look into this lovely, lovely, lovely books. So please, thank you for hosting.
Thank you very much. Fantastic. Very nice book.
Yeah.
From Apollonia,
yeah.
The protector of dentists.
Exactly. Only something for dentists. You need to